Have heart valve defects or disease but don't have the symptoms, and for some the condition mostly stays the same throughout their lives and doesn't cause any problems. But for others, heart valve disease slowly worsens until symptoms develop, and if not treated, advanced heart valve disease can cause heart failure, stroke, blood clots, or death due to sudden cardiac arrest. Gunderson cardiologist Dr. Raju Ailiani is joining us now to explain the risk factors and our treatment options. Good morning. Thanks for getting up with us.
Good morning, Amy. Thanks for having me on this segment.
Let's talk about the risk factors, especially if for some, you don't notice any symptoms. Who is at most risk for developing a heart valve problem?
Well, some of the commonest causes of heart valve problems are, although it's not as common in the U.S., rheumatic fever is one of the causes of valve diseases. So people can recognize strep throat infections in their early stages, and prompt and complete treatment of strep throat infection can prevent valve diseases. Also, a healthy diet, physical activity, other lifestyle changes, and certain medications to prevent heart attacks and maintaining normal blood pressure can also prevent heart valve diseases.
What are the actual symptoms of valve disease?
So, as you mentioned initially, for some people, valve diseases do not progress and they may stay as is for the rest of their lives and not cause any symptoms. But for some other people, valve diseases can worsen over a period of time and cause symptoms such as shortness of breath, heart palpitations, difficulty in laying down flat because of shortness of breath, chest pains, and rarely near passing out and passing out. And sometimes they can present with symptoms of complications of valve disease, such as formation of clots inside the heart chambers, which can cause stroke and sudden cardiac death at times.
Wow. So if you experience these symptoms, you need to be seen right away because you're probably late in the game when it comes to this. But let's say you go in, you're diagnosed with a valve disease problem. What are our treatment options?
So currently there are no medications that can cure valve diseases, although lifestyle changes and medications can relieve quite a few of its symptoms and prevent complications. Generally, by the time people have symptomatic heart valve disease, they generally need their valve, the faulty valve, either repaired or replaced by open heart surgery usually. But there are certain less invasive procedures for valves that don't open well, which can be opened by the use of balloon catheters. In the past, usually these procedures have had short-lasting results, and they are kind of time-buying procedures. But lately, we've been able to replace the valves actually with the help of catheters, especially a valve called aortic valve.
And we're out of time, but if that surgery is successful, what's the outcome for these patients? Can they continue to live a normal life?
Generally, if they present in a timely fashion and their heart muscle is not weakened, the results are very gratifying and they can live a normal life.
Well, that is great news. But again, if you have those warning signs, go to your physician and be seen. Dr. Ailiani, thank you so much for joining us.
Thank you, Amy.
All right. And we had to break with